This time the chair is going to call Joseph Kerwin, a self-retired physician, here to testify for the bill.
Mr. Chairman and members of the committee, thank you for listening. My name is Joe Kerwin. As you said, I am here to testify in favor of House Bill 30. Most of my professional career has not been in OB or general medicine, but the first part of it was. I delivered about 200 babies during those first 7 years of training and then practice. And there were a great variety of them. There were normal deliveries, many of them. There were premature deliveries. We delivered in the south side of Chicago some babies of mothers who were narcotics addicts. We saw a lot. And when you've done that, you can't have any doubt in your mind that a newborn, even a newborn premature baby, can feel pain and does feel pain, and one of your big jobs is to mitigate that pain, prevent it from happening, treat whatever's causing it. To me, that means that a mature infant in the womb also must feel pain, and the only remaining question is how early in the pregnancy can that infant feel pain. I'm not testifying as an expert to all the work that's been done to center around the 20-week time as the certain time for pain, but I'm here to speak for the bill because the pain is real, and because the children threatened with abortion are also humans. They are also future United States citizens. They too are entitled to the protection of the law to the degree that their pregnancy permits. And the big problem that we have is reconciling their protection with the protection of the mothers and the others who are involved. And I wish you the very best in balancing those freedoms.
Very good. Members, any questions? Dr. Kerwin, thank you for being here. Chair calls Andrea Ferrigno, Whole Women's Health, here to testify against the bill.
Good afternoon. Thank you for hearing my testimony today. My name is Andrea Ferrigno. I work with Whole Women's Health and have worked in abortion care in Texas for the last 13 years. I'm opposing HB 60 because it will gravely restrict women's access to safe, legal, honorable abortion care. Women who have abortions come from every walk of life, every race, every religion. Some are mothers, students, devout Christians, and from different demographics. 1 in 3 women will have an abortion in her lifetime, so the chances are good that you all know a woman who have had an abortion. This bill is designed to further a political agenda against the choice of abortion and not about the concern for the health of women. Texas already requires women needing abortion services over 17.6 weeks LMP to be referred to an ambulatory surgical center for a procedure that had been safely completed in an office setting prior to HB 15 in 2004. The Texas Department of State Health Services already requires licensed abortion facilities to comply with some of the same safety standards followed by an ambulatory surgical center. Some of these are administrative policies, which would include things like advertisement policy, referral policy, complaint resolution, compliance with the 24-hour waiting periods, confidentiality, employee orientation, fire safety, ID policy, medical abortion follow-up policy, medical record policy. We need to actually submit organizational structures, public education policy, quality assurance program, which I can also outline, referral policy, referring physicians from one to another within the same facility, security protocols, policies for unemancipated minors, privacy policies, policies for managing mail, We have multiple job descriptions and orientation programs for each one of the staff members. We also have medical protocols that include, some of them include conscious sedation protocol with specific identification of all the drugs that are used for this process. We have a discharge from aftercare instructions and protocol to do that against medical advice. We have no IUP and possible ectopic pregnancy protocols, medication therapy protocol, crash cart protocol, heavy bleeding, insufficient tissue, laundry, medical emergency, regulated waste, pathological waste, nitrous oxide, post-abortion contact, post-abortion problem triage, ultrasound protocol. We even have medical abbreviations protocols. We comply with OSHA. We have infection control protocols. And these are just some of them. And we also have, just to wrap up, I just want to say that 50% of the 2010 Ambulatory Surgical Center requirements, Chapter 135 of the Texas Administrative Code, is composed of physical plan and construction requirements that have nothing to do with the 10 to 15-minute abortion procedure that we safely offer in our clinics.
Thank you for your testimony. Members, quick question.
Could you tell me what the effect is on your unannounced inspections, on the way that y'all run your facilities?
Well, these are unannounced. We actually welcome it because we're compliant with all of the regulations, and those are things that some of them have been set forward for the safety of the facility. Some are just plain old political, but we still comply with them. And so those type of regulations, we're happy to follow because we understand that has to do with the safety of the patient and the environment of care. But from that to take it to where it needs to be done at a surgical center, it's a very wide gap.
What is it, the cost to? Because I understand Whole Women's Health has an ambulatory surgical center, and so. What is the cost, the difference in the cost between your facilities and the ASCs?
Well, I mean, it's there's people that are going to testify after me that have a lot more specific information, but I can tell you that operational cost alone is about $40,000 a year that a woman is going to have to. It's going to impact her ability to be able to access the service.
Because you pass the cost on to the woman.
Well, it has to be. Some of it is going to fall on her. As a matter of fact, we already do a lot of fundraising by private organizations to help with the cost as it is now to perform the procedures in the clinics because there's no other type of help anywhere. And so by making it all about surgical centers, it's gonna make a huge difference in the cost for the woman.
Thank you.
You're welcome.
Members, any other questions? Chair's going to call. Munir El Haram, Institute for Truth and Self, here's testify against the bill. Okay, we'll show Munir against the bill, not testifying. I'm not waiting for that. Stacey Edwards, Blue Bonnet Brigade, here representing Blue Bonnet Brigade and self against the bill.
Thank you, Chair and committee, for allowing me to testify today. My name is Stacey Edwards. I'm the treasurer of Blue Bonnet Brigade, and I am a constituent of Representative Kenneth Sheets in Mesquite, Dallas County. I'm here to testify against House Bill 60 because the interference between a doctor and their patient is of reach. How is it the state won't regulate firearms or fertilizer plants, but will regulate female fertility? Raising the standard of care is nothing more than a soundbite with no substance. Lieutenant Governor Dewhurst admitted in a tweet yesterday that the reason these bills exist is to close down abortion clinics in Texas. Governor Perry has openly admitted that it is his goal to eradicate abortion completely. Playing partisan politics at the expense of women's health and lives is unethical, it's immoral, and it's unconstitutional. The authors and supporters of these bills proudly profess to be pro-life, but to me it looks more like they are pro-birth, whose philosophy is spare the fetus, starve the child. Once the child is born into a desperate situation, how is he or she going to be taken care of? Is Governor Perry going to raise the standards of living by expanding Medicaid and raising minimum wage? If pro-life supporters, such as Representative Lavenberg said earlier, they have such a vested interest in the unborn, and she said earlier, to quote, every child is wanted by someone. Well, then how come we have 13,000 kids waiting to be adopted in this state? If someone is professing to be pro-life, then shouldn't they be concerned about the lives that are already in existence? A logical solution to this would be to reduce the demand for elective abortions through contraception. The Affordable Care Act has made provisions for these prescriptions to be covered. People argue they don't want tax monies to pay for these services. But to quote Ann Richards, that dog don't hunt. Because anybody who can add or subtract knows that it's cheaper to pay for contraceptives for a couple of years than it is to pay for food, clothing, and shelter for a child for 18 years. Reality is that we have serious issues in this state with education, unemployment, health care, and poverty. And the fact that we are wasting taxpayers' time and money on an issue that was settled over 30 years ago is political malpractice and an abuse of power.
Members, any questions? Thank you for your testimony.
Thank you.
Suzanne Hensel, the Lillis Fund and self here to testify against the bill.
And I actually have copies for you all. Is there someone?
That's fine. They'll pass them out.
Hi, my name is Suzanne Hensel. I'm here to represent myself and as a volunteer with the Lillis Fund. I'm speaking in opposition to House Bill 60 and 16. Thank you for the opportunity to testify this afternoon.
This is House Bill 60.
Okay.
So you
At this moment, I'm speaking in opposition to House Bill 60.
Thank you.
I listened closely to the Senate testimony on SB 5. I heard numerous senators express real concern about the safety of women and abortion procedures in Texas. This bill's stated goal is to increase abortion facility safety standards to the level of ambulatory surgical centers. The result is that 47 abortion clinics will close, leaving 5 ambulatory surgical centers open. This is a devastating blow to abortion access in West Texas and disproportionately hurts rural Texans. I think we all understand that the proposed legislation does nothing to reduce the need for abortions. Women will always want and need abortions. By restricting access, HB 60 will result in an increase in back alley abortions, self-abortions, and deaths among women seeking abortions. Furthermore, the Supreme Court has upheld that women have the right to an abortion up to the point of viability. Therefore, something must be done to balance these rights and the need for restrictions that the legislature would like to see. Enter the Texas Women's Access Transportation Safety Service. Representatives, I propose an amendment to HB 60 to fund a transportation network at a cost of $5 million per biennium. The Texas Women's Access Transportation Safety Service will be a network of buses that will allow women to assert their right to bodily integrity at the highest levels of patient care before women even enter the clinics. Buses will serve women in all communities, bringing them to one of the 5 remaining clinics for consultations and services. Upon boarding, they'll have the option to engage with comprehensive sex education materials that are medically accurate. These are materials that many publicly educated Texas women probably have not encountered previously. People do not have an abortion lightly. No woman gets pregnant to have an abortion. Sometimes people end up needing an abortion when they never thought they would. And we together, with this amendment, we can support those women. From working as a hotline volunteer with the Lillis Fund, I know that women seeking abortions are balancing careers and families. And because the legislature respects and values those women, they would not seek to make anything more difficult. That is why I strongly encourage you to amend House Bill 60 to include funding for the enormous transportation burden this places on women. I have attached 2 maps. Is that the end of my time?
Your time, if you can wrap up.
Sure, certainly. I've attached 2 maps. One is the proposed transportation route. Also, given the hostile nature of Texas's laws against women, the second map includes the eventual evacuation route for Texas's women, as their rights are taken.
I appreciate your testimony.